Hi, my name is Amanda, and this is my mock interview. First question. Tell us about yourself and what you think sets you apart from other applicants. Well, I'm a recent college grad from Bryan and Stratton College. I have my Bachelor's of Science degree in Health Service Administration, and in the past 10 years, I've been working in long-term care and volunteering in emergency management. In my current job, I received my position at a young start, so I do feel that I have courage. I also feel I am very optimistic, and I'm kind and caring. Next question. Briefly describe your biggest professional weakness. Well, my biggest professional weakness is having others accept me for who I am when I work in a position that requires many years of experience and starting very young. I had a very hard time having my coworkers accept me for the first couple of months in my new position. They didn't like that I was their boss and I was only in the company for 4 years. They also didn't like that my age was much younger than theirs. We worked together on team bonding skills, and they slowly realized why I was the right candidate for that position. Next question. Tell us about a time where you showed grit in the workplace. Well, right now, dealing with the COVID-19 pandemic, it has put a toll on everybody in the world, especially those in healthcare. In my building right now, our morale is very, very low. I have never shown this in front of the residents or in front of my staff members. I'm always trying to show them the courage that someday our normalcy will be going back in your careers. Well, in the next 5 years, I think I would like to just keep my current degree and work at my workplace. I will finally have 10 years if I stay with my current workplace, and that will give me a fresh start. The next 10 years, I would like to work on my master's degree and possibly venture out to a different workplace. And in the next 20 years, I would like to be head of a pharmaceutical company or a head of a hospital. Next question. Imagine you were promoted within the workplace. Describe how you would deal with colleagues who may have been passed over for the promotion or your coworkers who had been your peers but are now your subordinates. Well, right now, I did experience this a couple years ago when I started my new position. I had them sit down with me, those that were having difficulty accepting this, as they were there for 16 some years, and they believed that they were the ones for the position. I sat down with our boss and I sat down with human resources. It was to the point that they were harassing me every day at work. we I just let the other coworker talk it through why she thinks that she needed the position. I even showed her my own personal file, even though I didn't need to show her, because she needed that information she felt in order to move on, because she didn't believe I had the criteria. Yes, maybe I didn't need to show her this, but unfortunately, the way she works, that was the only way she was going to ever be able to move on. Slowly, she realized that the position that she was working in, she had worked in there for 16 years, and she unfortunately ruined relationships in order for her to move up. She eventually ended up leaving. So, if I ever had to experience that again, I would work with this problem a little bit differently than the way I handled it before. Yes, I would sit down with those that were having issues accepting or I try moving along. There are many colleagues I have that are very difficult to work in the workplace. I work with mainly females, so emotions can be very hard, strong at times, but keeping a professional manner has always worked out with the conflict. Next question. Explain how you handle conflict in the workplace with coworkers or with clients, patients, or customers. Like I have said in my previous questions, I have always kept a professional manner in the workplace. The most thing I've noticed was the patient or client or customer is always right. Even if you know they're not right, you're going to just do whatever you can to make the matter better. Even if you can't completely give them exactly what they want, you need to find them some way, meet in the middle. Same thing with coworkers. Finding myself being a boss and working with many females, when it comes to scheduling, it can be very dramatic and very emotional. I always try to work out a compromise for someone. For example, if one of my per diem coworkers wants to have this holiday off and they can't have the holiday off, they have to work it, I will let them leave an hour early or come in an hour late, and I will cover for them. Just finding that compromise where we meet in the middle always makes the situation better. Next question. Detail what motivates, inspires you in the workplace. For one, working on a big project or working to inspire others also motivates me. I like being the team leader when it comes to projects. I like showing others their capabilities in the workplace and how they can work together to make this project work or make the workplace better. That's what really inspires me. This is one of the reasons why I work in healthcare. I like taking care of people and making them feel better. I like working with other people. So, yes, working and inspiring others is what my favorite thing to do in the workplace and what inspires me. Next and final question. Summarize what you like best about your current or most recent job and why you are leaving the position. What I like most about my current job is that I work with veterans, and it's just an honor to be able to serve them as they served our country. I like that I'm able to help them and make their day a little bit easier. I right now do not want to leave my workplace. I want to work up in my current position to work higher up in the human resource office or to be the administrator. But I eventually will most likely have to leave my workplace if I don't have current people that are working those positions leave them. And this is my mock interview. Thank you.